Learning your pet is in congestive heart failure can be a scary diagnosis. But at the University of Illinois, a team of cardiologists and surgeons are using a new procedure to help dogs live longer, happier lives. Coming up, we'll talk to a member of the heart team on this new era of veterinary cardiology. Stay with us.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Well, we welcome to the program Dr. Sara Lo. She is a veterinary resident in cardiology here at the Veterinary Teaching Hospital at the University of Illinois. That's where we brought our show today. And a very important topic we're talking about today, and that is heart disease in pets specifically. Dr. Lo, thank you so much for joining us and taking the time. You're on call. You have many pups that you're taking care of today, so we appreciate a few minutes of your time. Let's start at the very basic. And what types of heart disease do dogs get?
Yeah, just like people, dogs can get heart disease starting from birth, and so we call those congenital heart defects. Those tend to be more abnormal communications between certain heart chambers and vessels. And then as they age, they get acquired heart diseases. And those underlying causes are multifactorial. Sometimes it's from their genetics, so certain breeds are more predisposed to certain diseases. Sometimes it's, what diet they're eating, things like that. And those acquired diseases can affect all components of the heart. So the heart, I like to think of as plumbing. You're sending blood in and then you're pumping it right back out. And so if there's anything abnormal with the valves that keep blood moving in a certain direction, with the muscle itself affecting its ability to pump blood, or even something affecting the electrical conduction systems, which are responsible for making the heart contract in a synchronous way, all of those can cause heart diseases.
How common is heart disease in pets? And let me say, when I say pets, let's throw in cats as well. I mean, I think a lot of times we do, it's dogs,
Yeah.
but how common is it? Both types of animals.
Sure. I think that, starting with the kittens and puppies, definitely less common. For dogs specifically, heart defects are probably only noticed about less than 1% of the time. But as dogs get older and cats get older, unfortunately heart disease can become quite common, especially for those breeds where they're predisposed. So the two kind of poster children for heart disease in dogs are the Cavalier King Charles Spaniels. They're predisposed to the most common heart disease that dogs get, and we're going to talk more about chronic valve disease today. But for Cavaliers over 10 years of age, unfortunately about 90% of them develop this heart disease. The other disease that is quite common is dilated cardiomyopathy. That's a disorder with the heart muscle. And we think of Dobermans for that disease, where between 45 to 60% of them will develop this over their lifetime. So, heart disease doesn't discriminate for your breed or whether you're a dog or a cat, but we tend to think of certain breeds being more affected.
What are some of the signs of heart disease if I'm a pet owner? What should I be looking out for?
Yeah, I think really there are sometimes quite subtle changes in the beginning. Other changes can be quite drastic. And so the more subtle things might be, slowing down on their walks or not being able to play as long, general, lethargy, sometimes they're feeling a bit weak, moving on to things like coughing that they didn't used to have. And in severe cases, you can notice fainting if there's not enough oxygen being pumped by the heart to get to the brain, or really difficult time breathing. Those can all be signs.
Do those creep up just immediately, or are these signs that happen over a period of time?
It kind of depends on the underlying disease process. So for those clinical signs we talked about, difficulty breathing, coughing, collapsing, they can be quite sudden, unfortunately. Like I talked about, the heart is plumbing, and so, as long as those tubes are working and those valves are working, they can kind of keep things under control. But once things hit a tipping point and those pressures increase and blood starts moving, in abnormal directions, those changes can be quite abrupt.
If I'm a pet owner and I've noticed some of the sudden changes that you've just talked about, I reach out to my vet and ultimately they come to somebody like you that is a specialist. How do you diagnose, or what's kind of the process of going through with an animal to determine what sort of heart disease they may or may not have?
Yeah, so the most important thing first is the owner's vigilance at home. They know their animals the best, and so picking up on those abnormal behaviors. The next step is their family veterinarian. With heart disease, in dogs specifically, not so much in cats, but the detection of a heart murmur, which is an abnormal heart sound with a stethoscope on a physical exam, is usually the first indication that there's something going on. So making sure that you're bringing your animal to a vet at least once a year for them to get their ears and eyes on your pet is typically the way that most of our heart, patients come to us. And that way we can intervene and try to start therapies before they reach that stage of having signs. But once, they come to us, the first thing we're going to do probably is some imaging of the heart. The test that is most commonly available, and family veterinarians are able to do it as well, are chest x-rays. These allow us to see what does the shape of the heart look like. Is it looking bigger than normal? Are certain parts of the heart abnormally shaped? That also lets us look at the lungs. And then because we here have the capability to do ultrasound, and echocardiogram or heart ultrasound lets us really look at the structure inside the heart and look at all those details that can clue us in whether we have certain heart diseases. Other tests that are helpful are electrocardiograms or ECGs. Those can tell us what the heart rhythm is doing. And in people as well as dogs, there are technologies to wear the ECG for a certain period of time to see what that heart rhythm is doing over time. So those are kind of our bread and butter tests.
Now, for those patients with chronic valve disease, there's a relatively new procedure that's being done at the University of Illinois. We're going to launch into that. So my question is kind of two-part. One, what is chronic valve disease? Is that a form of heart disease?
Yeah, so that's that most common heart disease that adult dogs get. About 75% of all heart diseases are chronic valve disease. And what this means is that the valves, which control blood flow from the upper heart chambers to the lower heart chambers, over time as animals age, they get thickened. And so instead of creating a nice seal and making sure blood is moving forward, they thicken and they allow leakage. And we call that leakage of blood regurgitation. On the left side of the heart, that valve is called the mitral valve. And that valve, when it is diseased, tends to cause problems. The other side can be affected as well, but we really think of it as primarily affecting that left side of the heart. And over time, the heart being a muscle, it's pretty smart. As that blood moves backwards, that upper heart chamber can get bigger, as well as the lower heart chamber, and that can eventually lead to those clinical signs. When that pressure increases so much, fluid backs up into the lungs, and they can develop coughing, difficulty breathing, things like that.
For decades, that valve, that chronic valve disease was treated by medications, but now, here at the University of Illinois, there's a relatively, as we talked about, a new procedure, and it's called TEER. What is TEER?
Yeah, so TEER, T-E-E-R, stands for transcatheter edge-to-edge mitral valve repair.
Ooh,
I know, it's a mouthful.
That is a mouthful.
Yes, and it is not to replace medications. That will always be our primary recommendation, but it has allowed us this alternative therapy when dogs, unfortunately, aren't responding to medical management, or the gold standard of treatment for valve disease, which is actually open heart surgical repair, isn't feasible, whether it's for cost concerns or the dog is too sick to travel to the places that offer it, which unfortunately are Japan, the UK, or Florida. So this kind of serves as a bridge between those options. And with this surgery, what we're doing is we're actually placing this little device here. And if you can kind of take a peek at the top, there are two wings on either side, and this is what we call the V-clamp. This was developed by a company in China relatively recently. In veterinary medicine, this started being used back in 2021 by Colorado State University. We've been doing this procedure since September of 2022, but in humans, they've been doing this procedure since the 1990s. So we're definitely in our infancy of the program. But what this does is allows us to grab the edges of those mitral valve leaflets that maybe due to this disease process are further apart than they should be. And so there's just a lot of room for blood to move backwards. There's maybe abnormal motion of the valve, and this grabs it, secures it, and we actually will then bring them together to try to decrease that regurgitation. And so the overarching goal of this procedure is to decrease the amount of mitral regurgitation or blood moving backwards.
So you said that medication is always going to be a part of the regime, but when is this particular procedure, the TEER procedure, recommended for dogs?
Sure. I think we are still learning, what are the best candidates for this procedure. It has proven to be viable across kind of multiple disease stages, but here at the University of Illinois, we are recommending the TEER procedure for dogs that do have advanced heart disease, where unfortunately their heart disease is going to be their life-limiting factor, and we're hoping that this disease can extend their lifespan, but most importantly their quality of life. And that typically means that medical management isn't cutting it. They're still going back into heart failure, still not breathing well and low energy, and they, either due to finances or other reasons, open heart surgery isn't an option. So those are the candidates that we are recommending this to. And then that kind of brings us to our, assessment of eligibility. So unfortunately, not all dogs with valve disease are going to be eligible for this procedure. The kind of most important thing is the individual anatomy of their mitral valve. So the mitral valve is kind of a circular structure where it opens and closes, and so there's a lot of variation, size differences differences in motion because there's only a certain number of sizes of the device and limitations to what we can do with it. Those are kind of how we pick and choose.
Is it mostly older dogs or
Yes.
middle-aged dogs? Do you do this procedure on puppies as well?
No, this disease process only affects adult to older dogs. And so, you know, until this heart disease is severe enough to be this dog's life-limiting factor, we're not bringing this up.
It's a cardiologist or a cardiology team effort when you
Yes.
do this. So it's not like you bring them into an office room like we're sitting in. There's multiple people that are involved in this. Can you talk about who's actually in the room when this happens?
Yeah, it's quite a commotion on what we call a TEER day. So we work closely and depend heavily on the expertise of our soft tissue surgery team. Specifically, Dr. Clara Moran is the surgeon. Our anesthesia team is invaluable in keeping our patients stable during the procedure, and then the nursing staff as well here, just for recovery and helping them, you know, get to discharge. For a typical surgery day, we will start with imaging of the dog's heart. We can do ultrasound actually 2 ways for the heart. The first is transthoracic, so we put a probe on the chest and can see the heart that way. But an even better modality, which unfortunately requires general anesthesia, we actually can put an ultrasound probe into the esophagus. And that structure runs right over the heart, so we get a beautiful image of that mitral valve in question. And we start with that because it allows us to make the most precise measurements and assessment to kind of pick and choose what device size or even if surgery is the best choice for this patient. After that, if we decide where to go, then our surgery team, they make about a 3-inch incision into the left side of the dog's chest to allow us to access the heart. And then they kind of step aside, and then the cardiology team steps into the surgery. And what we do is at the bottom of the heart, so I have a little diagram of the heart here, and this is a ventricle. This is actually the left ventricle. If you can imagine, the chest wall, would sit here, and we have access to the bottom of the heart. And what the cardiology team does is makes a needle poke into the bottom of the heart to place an introducer. And I know the size may seem shocking, but there are smaller ones out there. And we essentially just make a small poke into the bottom of the heart. The beauty of this procedure and the advantage over potentially open heart surgery is that it's a beating heart procedure, which means that we don't have to stop the heart from moving to get what we need to do done. And so we're able to place this introducer into the bottom of the heart, and so it would be sitting inside the heart, and that is a tube that allows us to facilitate the passage of things through it. The first thing that we would place through it is this cute device. We call that a mitral ball, and you can squish it. It's very atraumatic, which means that it's not going to cause damage inside the heart. We would actually place it within this introducer, and so inside the heart, we can push it all the way up into that top chamber. And then once we are up there, then we can place through this same introducer our actual V-clamp device. All of this is guided by that transesophageal echo, which allows us to see in a 3D plane, are we placing it in the perfect location? And so after we've placed that clamp on and locked it up, this device actually untwists and we leave the V-clamp within the heart. Everything else comes out and the surgery team helps us close up the chest. So that is,
You
surgery
simplified
day.
it, but I'm sure it's a very long and complicated.
It sure is, and there's a lot of, I think, concerns and tension, but it's all
Yes.
because we want the best outcome possible.
Speaking of concerns, I'm sure
Yeah.
going into a procedure like this, pet owners they want to know you know, what complications could happen during a
Absolutely.
surgery like this?
Yeah, so we are, first of all, dealing with already quite sick animals. And so we have a number of complications, unfortunately, associated with this procedure. And these complications, they, you know, vary in severity, but unfortunately, there are ones where if they occur, they would be fatal. And the first one that I wanted to talk about is something called single leaflet attachment, where, as you saw, there's kind of two wings to that V-clamp to grab either edge of the leaflet. There's two mitral valve leaflets, and if anything were to happen to one of those sides, then you could lose capture of one leaflet, and that would result in this device, unfortunately, being unstable and leading to even more regurgitation rather than less. The other complication we see that is quite serious and does lead to fatal complications is actually damaging that leaflet tissue itself. These dogs, you know, their heart disease is at the level of the valve. So those valves are weak, they're thickened, and placing a clamp on them sometimes is too much, you know, pressure or tension that they can handle. We're constantly learning, you know, which patients, you know, are at a higher risk of those complications, but we're still evolving and doing our best to minimize them. But unfortunately, at this stage in development, we can't get rid of it. Yeah.
But those that come out of surgery and they're doing well, what does life look like after surgery for those animals?
Yeah. So, you know, the best feedback that I've gotten from owners is that their animal's acting like a puppy again. I think that's not necessarily the majority of cases, but that is our best case scenario, where they're feeling great. They're not, you know, dealing with such a big heart and fluid back up into their lungs, so they're breathing easier, more energy, and that's our goal for all of these patients.
And new to your life, I think we should talk about this too, is that you're a dog mom, a pet mom, and you've brought a pet into your family with heart disease. Can you talk about Gus? Because we're going to see some pictures of Gus in our episode.
I would love to talk about Gus. Gus is a little 9-month-old pit bull, and he came to us in May for surgical correction of a congenital heart defect that we call pulmonic stenosis. So again, something wrong with his valve, but this time the valve leading blood flow into the lungs, it was too narrow, so he didn't have enough blood and therefore oxygen getting to his lungs, and so he unfortunately was pretty lethargic, and then we did a surgery for him called a balloon valvuloplasty, where we blasted those tight valve leaflets opened, and even the next day his foster at the time was like, I don't recognize this dog, he has so much more energy. And I fell in love and took him home.
Oh, so the veterinary cardiologist now has a pet with a special heart.
Yes, it's such a cliche.
Oh, well. Any other success stories that come to mind as we wrap up our interview today? Any clients that come to mind, maybe that when you saw them come in, your heart really tugged a little bit, but after the surgery, they're a new animal?
Oh my gosh, so many. I feel so lucky to work in a specialty where I do get to see these puppies, and we're able to do these surgeries that mean they can have a normal lifespan. That's always really rewarding. But also our older patients, you know, I find it really special when, even as they're getting older and they're slowing down, we can institute different medications and things to help them feel like themselves again.
The best advice, as in the last couple of seconds, to pet owners, if they do see something, notice something, a change, the best advice is call your local veterinarian.
Call your local vet. Yeah, they really are the superheroes, and they're the first step to getting that right answer. And so if you have any concerns, you know, owners know their animals the best. So it's the first step.
Dr. Sara Lo, thank you so much. I know that your time is precious. You've got a pup that you're monitoring as we're doing this interview. So thank you so much for spending a few moments talking about heart disease and the wonderful procedure called TEER here at the U of I.
Thank you so much.
And thank you, our viewers of the Paw Report, for joining us for this episode. Until next time, I'm your host, Kelly Goodwin. We'll see you then.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.